Bonjour and
Good day.
to everyone. Today, I'd like to reflect on the trend of the pandemic and the perseverance of Canadians. Starting with the numbers update, there have been 117,031 cases of COVID-19 in Canada, including 8,947 deaths. 87% of people have now recovered, and labs across Canada have tested over 4,178,000 people for COVID-19 to date. Over the past week, an average of 46,283 people were tested daily, with 1% testing positive. Based on the most recent 7 days, there have been an average of 347 cases reported daily from across the country. As some jurisdictions haven't reported new cases over the weekend, we can expect this to go up as the weekend numbers come in later today. And this is why we've been looking at the 7-day average instead of just relying on the daily numbers. Beyond the numbers, my deeper long weekend reflection was on the concerning global trend of the COVID-19 pandemic and how we can maintain our perseverance against this ongoing threat to our health and society. Canadians have made many sacrifices, and I want to say how thankful I am to the great majority who continue to follow public health practices as the evidence evolved, including the wearing of non-medical masks or facial coverings in indoor public spaces and when physical distancing is difficult to maintain. I know these adaptations have been difficult, and the uncertainties of an emerging disease event on this scale have been stressful, to say the least. In this situation, the stakes are very high, and it is more important than ever that we take an approach that is informed by the best available science and evidence. While some decisions have to be made when the evidence is incomplete, we must remain open to all lines of inquiry, carefully gather the evidence, and adapt and change our approaches as the science evolves. For some people, the change won't be quick enough. For others, it'll be too quick or not convincing enough. Everyone will have questions, some more than others. It is perfectly acceptable to have questions, and no question should be considered silly or wrong. Questions are healthy. They challenge us to think things over from all perspectives and to thereby reach a solid conclusion that can stand up to healthy scrutiny. In fact, we all need to scrutinize when we read, listen, and share information. It is no secret that there is a lot of misinformation swirling about. Following the wrong lead can be distracting and harmful. Every one of us has a role in making sure our sights and energies are focused on the right path. When information comes to us, we need to critically evaluate, check against credible sources, and not share further if there is any doubt as to its validity. Sometimes, the best guide is a simple one. Here's one that I have referred to before, most often attributed to the 13th century Persian poet Rumi. It's known as the 3 gates of speech. Before you speak, let your words pass through 3 gates. At the first gate, ask yourself, is it true? At the second gate, ask, is it necessary? And then the third gate, ask, is it kind? We've got a long road ahead, so don't lose hope, stay the course, and keep being part of the solution. Donc, ensemble,
Let's keep it together. Thank you.
Bonjour. Aujourd'hui, nous aimons...
Hello. Today, we would like to speak about the trend of the pandemic and the perseverance of Canadians. Starting with the numbers update, there have been 117,031 cases of COVID-19 in Canada, including 8,947 deaths. 87% of people have now recovered. Labs across Canada have tested over 4,178,000 people for COVID-19 to date. Over the past week, an average of 46,283 people were tested daily, with 1% testing positive. Based on the most recent 7 days, there have been an average of 347 cases reported daily from across the country. As some jurisdictions haven't reported new cases over the weekend, we can expect this to go up as the weekend numbers come in later today. This is why we look at the 7-day average instead of just relying on daily numbers. But beyond the numbers, my deeper long weekend reflection was on the concerning global trend of the COVID-19 pandemic and how we can maintain our perseverance against this ongoing threat to our health and society. Canadians have made many sacrifices, and we want to say how thankful we are to the great majority who continued to follow public health practices as the evidence evolved, including wearing non-medical masks or facial coverings in indoor public spaces and when physical distancing is difficult to maintain. We know that these adaptations have been difficult, and the uncertainties of an emerging disease event on this scale have been stressful, to say the least. In this situation, the stakes are very high, and it is more important than ever that we take an approach that is informed by the best available science and evidence. While some decisions have to be made when evidence is still incomplete, we must remain open to all lines of inquiry, carefully gather the evidence, and adapt and change our approaches as the science evolves. For some people, the change won't be quick enough. For others, it will be too quick or not convincing enough. Everyone will have questions, some more than others. It is perfectly acceptable to have questions. And no question should be considered silly or wrong. Questions are healthy. They challenge us to think things over from all perspectives and to thereby reach a solid conclusion that can stand up to healthy scrutiny. In fact, we all need to scrutinize when we read, listen, and share information. It is no secret that there's a lot of misinformation swirling about. Following the wrong lead can be distracting and harmful. Every one of us has a role in making sure our sights and energies are focused on the right path. When information comes to us, we need to critically evaluate, check it against credible sources, and not share it further if there is any doubt as to its validity. Sometimes the best guide is a simple one. Here is one that I've referred to before. It is most often attributed to the 13th century Persian poet Rumi. It is known as the 3 gates of speech. Before you speak, let your words pass through 3 gates. At the first gate, ask yourself, is it true? At the second gate, ask, is it necessary? At the third gate, ask, is it kind? We've got a long road ahead. Don't lose hope. Stay the course and keep being part of the solution. Thank you.
Thank you, doctors. We will now open the phone line to questions. Vous pouvez poser vos questions dans l'une des 2 langues officielles. We ask that you limit yourself to 1 question and only 1 follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics. Operator, over to you for the first question.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, veuillez appuyer sur étoile 1 maintenant pour poser une question. The first question is from Mia Rapson from the Canadian Press. Please go ahead.
Yes, good afternoon. I'm wondering, Dr. Tam, there's a lot of hope being placed in the vaccine, and we've seen some reports of positive results from some vaccine trials. They're in phase 3. But there also seems to be a lot of people who think once that vaccine is approved, that this pandemic will be over. And I'm wondering if you could speak to that. What happens once that vaccine is approved, and how realistic it is for a timeline for us to be able to return to a much more normal life once we get a vaccine?
Thank you. That's a really important question. And I think it is amazing that the world has come together and there are so many vaccine candidates that's being evaluated And some, as you say, there's been several of them that have initiated what we call phase 3 clinical trials. And these are much larger than initial phase 1 and 2 trials, where smaller numbers of people have been vaccinated to look at safety and to look at the immune response, for example. In these phase 3 trials, what the clinical trials objectives are looking at, of course, are safety profiles, which are very important. And then looking at the efficacy or the effectiveness of the vaccine. We call efficacy when it's in phase 3 trials. So you're looking at tens of thousands of people as opposed to a smaller number or a few hundred people, for example. So we will be able to then characterize the vaccine's effects on the immune system a bit more in depth, and looking at a broader range of potential adverse events. And it still will be outstanding questions, even after phase 3 trials, on the degree and the duration of the immunity. How many doses of vaccine do we need? Do we need a booster later on? Some of it, the success of the vaccination program will also depend on how the virus is undergoing evolution. Would it change? Would the current vaccine need to be adapted if the virus should change? So there's quite a lot of unknown questions. But what we will see is that as phase 3 trials get we will have much more information of the next stage, which is scaling up the use of the vaccine in the wider population. And even at that stage, we need to monitor very carefully the effectiveness, but also the safety when it's being administered. So all to say is that we have to use all avenues to try and get a vaccine or even more than one vaccine for the Canadian population. But really, honestly, we don't know at this stage whether the vaccine, how effective the vaccine is going to be, whether it prevents serious illness and hospitalizations. Does it prevent you actually getting an infection? Because some vaccines, influenza vaccines, for example, prevents you from maybe serious outcomes, but doesn't necessarily prevent you from getting the infection altogether. So these questions remain unknown. So I would say that vaccine is a very important aspect of the response going forwards, but we can't at this stage just put all of our focus on in the hopes that this is the silver bullet solution. It is a very important solution if we get a safe and effective vaccine. But I would say that the public health measures that we have in place, the sort of personal daily measures that we take, is going to have to continue. And quite honestly, a lot of it is good personal hygienic practices that we should sustain in the long run anyways. So I think in terms of timelines, a lot of the companies looking at phase 3 clinical trials are really hoping that they'll get some results by the end of this year. Some of them are very ambitious. Some of them are saying, well, maybe the beginning of next year. But that still doesn't mean that we have vaccines for everyone. It's likely that there won't be enough vaccines for the population as the vaccine rolls out. So there'll be prioritization. They'll be looking at that. So I think we're in it. We're planning as a public health community that we're going to have to manage this pandemic, certainly over the next year, but certainly maybe, planning for the longer term of the next 2 to 3 years, during which the vaccine may play a role, but we don't know yet. I would say that I do agree with Dr. Fauci in the United States that we can be cautiously optimistic, but not, it's one important layer of protection. We also don't understand, as I said, the immunity of the human body to the virus and the vaccine. So much needs to be learned I'm taking a bit more time answering this question because I think it's worth, in the next while, for us to keep Canadians informed as to what's going on and what clinical trials mean. So thank you for the question.
Yeah, it's Dr. New. Maybe I just would add on to what Dr. Tam has said. She gave a very comprehensive answer. And I think the bottom line, I think, as the question was asked, is that, people might think that if we get a vaccine, then everything, quote, goes back to normal the way it was before. And that's not the case. As Dr. Tam and others have mentioned, a vaccine will not be a silver bullet. It'll certainly be an important tool. It'll be something that hopefully we can use to effective purpose for a large part of the population, or certainly for certain vulnerable populations. But all of the measures we've put in place now will still have to continue with that new reality for quite some time. So certainly I think we need to temper people's expectations, thinking that the vaccine is going to be that silver bullet that will take care of everything, and everything we've done up to now won't be necessary in the future. Thank you.
I'm
Just wait 1 minute, Mia. We're going to repeat the answer in French, and then we'll proceed to your follow-up.
Okay. Okay.
Answer repeated in French. We can say that researchers around the world have all worked to vaccine so that for the world population. But even if we find a vaccine, as we say in English, it won't be a silver bullet solution, because there are all sorts of issues that will remain, even distributing the vaccine, for example. And the situation will remain, and all of the public health guidelines. The vaccine will merely be one more tool that will be available, but it's not the panacea. Thank you.
Yeah, I'm also wondering, given that we've seen sort of the numbers bouncing around in some places that were low, and now we're seeing a bit of a surge in some places, do you have a threshold that you've set that in your mind, or even on paper somewhere, for when you would recommend that more severe lockdown measures be returned? Is there a case rate, an RT rate? Do you have anything like that you could tell people what they might look for to when that might happen, if that was to happen?
Yes, so the objective, and I think we've talked about some of this in our modeling or epidemiologic update sessions, is, of course, we're watching the trend, the laboratory percent positive that we are seeing in the test results. Right now, it's low, with the overall 1% or positive rate. So if that's trending up, that is something of concern. In the Canadian context, we haven't set a specific trigger for that percent positivity, but we know that if it's trending up, it's moving towards 5%, we are taking sort of more, paying attention to that. At the beginning of the pandemic, the concept of a sort of 10% positivity rate as being in a sort of right range for both sensitivity of the system to detect and, determining if the virus is prevalent in your community was one concept. But we're sort of, I think, lowering that threshold to, 5% is a warning sign for sure. But there's lots of other contexts. We talked about this reproduction number, and we've been hovering around that one mark. Again, it's sort of looking at that trend. Right now, that R naught is less helpful when you've got small numbers bouncing around, so you'll see that erratically going up and down sometimes. But if overall that goes beyond 1 and continues to escalate, that's not a good sign. Some jurisdictions, for example, in Alberta, are monitoring and flagging communities that have a rate of illness of 50 per 100,000. So that's another threshold that communities or public health professionals have been watching for as well. But it's really a composite of everything. we know that ICU and hospitalization indicators are a late indication of disease spread, but nonetheless, it's also a very important marker for, are you now hitting vulnerable populations? Not a good sign. So it's not one number, one specific trend, but a sort of composite look. And it's being watched very carefully. The other aspect to be watching for is your capacity to test, trace, follow up, quarantine, and isolate, because the concept right now is to keep this epidemic under control by having a public health system that can clamp down on every outbreak and every little fire that comes up. But if there's lots of them, which is not what we want to see, then the public health capacity to do that and must be monitored as well.
Thank you, Dr. Tam. Operator, next question on the line.
Thank you. The next question, la prochaine question est de François Carabin du Journal Métro. À vous la parole.
Question from Metro newspaper. Hello, thank you for taking my question. I'd like to speak about steps taken in schools. It's inspiring a lot of debate in Quebec and in Ontario. In Ontario, it has been chosen to impose the mask measure starting at 4th grade. I'm asking what Health Canada's position is. Are you in favor of elementary school students wearing a mask? What is your position on this? Wow, thank you for the question. Firstly, I can tell you that that Health Canada doesn't have a position. We agree with our authorities in all provinces and territories. We're in the process of carrying out analyses on all scientific data and experiments and experiences lived in other countries. The most important thing we see when we look at schools is when we look at community spread. We need to look at whether or not there is spread that is out of control in the community. In Canada, we have done a very good job, and that is why we are now at the point where we're asking ourselves what should be done next with schools. There really is a consensus that we know certain things that we can do to control the spread of COVID-19. But we also know that there are some unanticipated circumstances. When it comes to chronic illness and children, all experts tell us that mental and social development is very important for children, and this has to do with the school situation. For young children, it is very important to their social development for them to be able to play with their children and to meet other students at their school. And that is why we have arrived at this point where we now are. Regarding COVID-19, we know that there are certain levels of protection, such as social distancing, for example, good hand washing hygiene, for example, and wearing facial coverings or non-medical masks. And that is true in all provinces and territories. And we can look at each school and its particular infrastructure to find out what the situation will be with the students and the teachers to ensure that they have good access to hand washing stations. When it comes to hand washing, the position isn't quite so clear-cut. We know that, or rather, when it comes to social distancing, it's not as clear-cut. We know that children are susceptible to the disease, but we don't know if they can transmit it to the same extent that adults can. After 10 years of age, it is believed that children become like adults and they transmit the disease in the same way that adults do after the age of 10 years. There is a decision that must be made for each province and territory to determine what can be done to facilitate social distancing of 2 meters. And there are options. For example, perhaps a cohort of students could be maintained throughout the duration of the school year. And other than that, we have the matter of masks. From looking at other countries in the world, and also from looking at provinces and territories, we consider that wearing the mask is very important for all children over 10 years of age. We have looked at scientific data, and we know that it is effective to wear a facial covering. And so it might take a while for children to get used to it and not to touch their faces, etc. But this is something that I believe that all provinces and territories are still analyzing. A political recommendation has been issued in certain provinces, and it's important to continue analyzing and discussing this matter. The next school year in this COVID-19 context will be a certain type of experiment. I have heard it said that, oh, young children aren't capable of wearing a mask because they'll be playing with the mask and so on. But I don't think we're giving enough credit to children. I think that some children have even started to get used to wearing masks over the summer. It's not a question of whether or not they're capable of wearing the mask. It's can children wearing masks help stop the spread of the disease? When we look at the data, we see that there might be other options, but that is the option that we have now given the data. Thank you. Follow-up question? Thank you. No, I do not have a follow-up question. Thank you very much.
Question?
Mike?
No, please.
You go ahead.
No, please.
Bonjour, Philippe Vincent Foisy.
Question from Philippe Vincent Foisy from Radio-Canada. Here I am in person. I just listened to what you were saying about masks, but I'm not sure I understand. I understand the function of the masks. I understand masks are effective. I understand that children above the age of 10 years can spread the disease the same way that adults spread the disease. So we have an effective solution, and we have a population that can spread the virus like adults can, but we're not using that solution of wearing the masks as it would be done. So I'm just trying to understand why you don't say that that would be the best solution. I know that provinces have to make their own decision, but you just said, all that you just said, that it's effective and it would be a good thing for children over the age of 10 to wear the mask as a precautionary measure. Answer: yes, but as I said, given all of the well-founded scientific data that we have to date, we've looked at 2 groups, so children under the age of 10 and children over the age of 10. This is a current issue that should be discussed and should be managed in all provinces and territories. And I think this is why each province and territory has developed its own strategy looking at the data. Because different scientists can look at the same data and might deduct differing conclusions from the same data. What I see from analyses is the following. Yes, children over the age of 10 spread the disease the same way adults do. And I think that's even the policy in Quebec, isn't it? Children of 11 or 12 years of age are considered like adults and they must wear the mask. Now, at school, I think that the principle remains the same. I think the question can be posed. Perhaps they won't look at a certain age specifically, but if we look at all of the data, we can see that there is not a lot of evidence to suggest that very young children spread the disease to other children or even to adults. So that's one thing that needs to be looked into. And another thing is the following. It concerns young children. And it's part of, and it concerns facial expressions. So very young children use the facial expressions of their teachers to understand. And so wearing a mask in that sense could really diminish their school environment. Second question, regarding tourism. Some people are saying that a 14-day quarantine is mandatory when re-entering Canada. That is harmful to tourism. That doesn't help companies whatsoever. Is there any way over the coming weeks and months that will be changed? Perhaps through testing or otherwise. In the short term, do you think that restrictions will be relaxed for people returning to Canada? Answer. Yes, well, regarding technology and what we know about the virus, we know that the incubation period is 14 days. Everybody knows that now. It's 14 days for the incubation period. Now, regarding our borders and tourism, I can tell you a story. I'm a Trekkie. I'm like a Trekkie in English. But unfortunately, you can't do as you do when you're a Trekkie and show your badge and go through. We're not at that stage yet with COVID-19. But perhaps with more work, better testing methods will be discovered. We have many researchers working on tests. And some tests are not yet reliable. They're still being tested. So we don't know yet. Perhaps at some point, thanks to a combination of technology and new data on the virus, things will change, but the policy remains the same for the time being.
Hi, Michael Couture from Global National. Dr. Tam, I wanted to talk to you about the COVID Alert app. And what do you say to critics who say that the technology, because it is quite advanced, is limited in terms of its efficacy because it doesn't work on older phones? And oftentimes older phones are owned by elderly Canadians or lower income Canadians who are greatly affected by COVID-19.
Yes. So the COVID Alert app is a notification app, just to make sure other audiences understand this. So it alerts people in an anonymous way. If someone who's test positive puts a code in the phone, it'll alert people who have been in the proximity of that phone if they also have the app. So I have also heard some feedback over the weekend in terms of what you just said, which is older phones perhaps past the sort of 5-year kind of newness. Is that a word? Older than the past 5 years, the app may not be compatible. And I'm not a technologist, so I think that has to go back to the Apple, Google, company for that particular indication. But just to sort of look at it from a public health perspective, you're right in that there could be people who don't have access to phones, who don't have a new latest phone, who may not be able to use this. But I still think that it is as many people who can download it and use it as possible will make the app more successful. I'm actually thinking, in discussion with other medical officers of health, it may not be the sort of broadest coverage that you need, but what if you're in situations, for example, before you walked into a pub, before you walked into a nightclub, or other places where there could be a bunch of people that you may not know who's not in your specific social circle, where notification is particularly important. So maybe also targeting the application in certain settings and asking users to download it, who may in fact be the younger generation with the phones, is still, I think, very relevant for that setting. But I do think that this is something new, and as the application is being piloted and tested, some of these feedbacks will come back, which I think will be directed to the relevant people who can address that, which I can't do. But I still think, despite these gaps, we need to have a go at using it. And it may not have to be broad coverage everywhere, but certain settings that might be the exact settings that you want to use it in, workplaces or other areas where it is really helpful if people around you are notified without you having to, reach them, or public health having, really trying to catch people up as fast as they can. This might help them. So that's at least how I look at it. But I do think that if there are limitations, please send the questions in and they'll be directed to the right place, I think.
Thank you.
So just as a follow-up, I wanted to ask you then, so how do you propose reaching those people of lower incomes and older Canadians who may be falling through that technology gap? And B, in your suggestion of kind of a location-based thing, are you even exploring the possibility of a different app or a different notification system that may be applicable, as you said, to nightclubs, pubs, or bars?
Well, I think what I was thinking is that these are some of the discussions with other chief medical officers. That now they're asking people to, make sure you know your client list and keep it for a while. Well, this could actually be very useful. Use the COVID alert app. I'm not saying a new app, but that could actually be quite helpful if it's kind of difficult to keep, contact lists. But that's the kind of concept I think public health locally will provide these kind of directions to their businesses or these locations. But the COVID alert app might add a level of functionality so that, it could be an additional benefit. I think we've always thought of it as just another tool and can't replace the other existing tools. And so for the hard to reach populations, public health will still be doing the very, as rapid as possible, the contact tracing and individual contact tracing that's required. But, the pandemic is showing the sort of disparities in the pandemic itself and the accessibility to measures more broadly. So that's a wider societal issue. And I think some of the supports provided to more disadvantaged populations are really, really important. But needless to say, this is one layer, but it's not the only layer. So we may have to sort of continue to resort to some of these other measures, like keeping at your entrances to any establishment lists, or public health being able to, with everybody's cooperation, show up to be tested, show up to be connected if you've been told that a certain setting has experienced an outbreak. So those traditional means will add additional functionality.
Thank you, Dr. Tam. Next question in the room.
Hi, Tom Parry with CBC. Dr. Bonnie Henry out in BC is saying that she's having a hard time getting reliable information from airlines to try and do contact tracing. I'm wondering if you're hearing that from other provinces, how big an issue this is, and I guess how much harder it makes it. And is there anything you can do about it, the federal government?
Yes, so I think what Dr. Henry is referring to is that getting what we call plain manifest has always been a challenge. And depending on the airline, some of it is missing all sorts of information so that you can't actually reach the persons in certain seats, if they stayed in the right seats, that is. So I think there's been a number of enhancements that would be helpful. One is, of course, the ability for us now to collect contact information from arriving international passengers. And the use of the ArriveCan app. I think if we can have everybody use that app, it would become easier, I think, for us to be able to ascertain what flight individuals have been on. But it is an area that other departments, such as Transport Canada, are sort of working through as well. Which is why, as a sort of, at the beginning of the epidemic, there was an effort to trace contacts, which was quite difficult. And we didn't have any yield. There wasn't an actual transmission event that we could detect on the plane. So the public health energy turned to managing the outbreaks domestically. Very few of our cases actually come from travelers at the moment. But now that our case numbers have gone down, there's been more interest in, well, why don't we follow some of these planes and see if there's been, any contacts at all that's been exposed or transmitted. But all I can say is we haven't got a reported case of transmission in flight. But I do think there's an opportunity going forward to maybe look at that in a new concerted way. And so if with the provinces, right now, what we're doing is just putting up a list of flights with a positive case on it. Whether you've been exposed doesn't mean that transmission has occurred, that has led to a spread in the community. But I do think that more effort in looking at how we best get that contact information could at least help us evaluate the data better going forward. So I think we are in the process of looking at how we better do that.
Just in terms of, you were talking about before about a vaccine not being a silver bullet and this being kind of a multi-year process. Psychologically, how do you think Canadians should be preparing for the future, for, thinking about kids going off to school or people trying to plan a wedding or things like that? What do Canadians have to keep in mind as we look ahead to the coming years?
Well, I think collectively the sort of public health system is trying to look at, well, what are the sustainable ways that we can adjust our daily lives that can just keep going? So some of the more sustainable measures we keep messaging to Canadians in terms of as much as possible that physical distancing, don't go in crowds, maintain the number of contacts as small as you can, hand hygiene, but also more and more trying to convey the concept, what we call the 3 Cs, closed environments, crowded environments, and if you're close face-to-face contact with someone and speaking to them, we need to adapt so that especially hugs or to adapt those settings to reduce the risk. So you're seeing whether it's schools, whether it's universities, whether it's pubs, are trying to adapt so that we can just keep going without sort of escalating the transmission risk. And this concept is to keep the epidemic suppressed in a sort of slow burn and stop any kind of resurgences. So we may expect to message to Canadians that these things, and wearing a mask, by the way, and we just talked about, then becomes part of your daily routine as you go out the door, You have your hand sanitizer, you have a mask. If you go into a closed space, you're going to put it on. If you can't distance yourself, can't predict, you're going to do that. And so that kind of behavioral change doesn't come overnight. But what I think we're all heartened by is that the majority of Canadians are following public health advice. And kids can be taught so that we begin to continue in this sort of adapted way of living. And so I think that's at least one aspect, while we're still researching treatments, vaccines, better diagnostics. So better diagnostics might help us in certain ways of returning back to normal a little bit more. The question about is the 14-day quarantine a concrete thing? Well, we'll keep reevaluating it. Right now is the most reliable method. Is there an ability where we can test people during the quarantine period to adapt that quarantine period? That is under active evaluation, but it's still not as certain as that 14 days. So I think, again, I think we ask for patience, ask for compassion as we try and get populations adapt. And there is no other way. Perseverance and patience. Keep going. Learn your routines.
Thank you, doctors. Ian Woods will take your last question.
Ian Woods, CTV News. Dr. Tam, there's been some reports that workers, migrant farm workers in southern Ontario have been asked by their employers to basically stay in place and not leave their quarters. Does public health need to take any action against the living conditions that these workers are living in? Reason being, many of them are in bunkhouses, shared sleeping quarters, trailers, in very confined cases. And before, it's already been said that, in an ideal world, they would have an individual living quarters and washroom and that. Granted, the living conditions now, are these things that need to be shut down or looked at further?
I think that's really, really important. We know, based on what we've learned, that these conditions are how this virus can spread very readily, and that we must support workers in order to work safely, to support them if they're sick, and to support them if they do need to be in quarantine. But the most important thing is actually prevention, which actually means changing the actual living environment so that they're not such high risk. And I believe it was only last week that Minister Qualtrough had provided some announcements about further support to temporary foreign workers, just to improve these conditions and also support non-governmental organizations that are trying to help these workers. So I think those are the kind of things that are all moving in the right direction. But the bottom line to your question is, yes, we have to do better. And public health issues also involves what we call social determinants of health and living and housing. And so it is part of public health's role to outreach to other sectors who can actually help improve those conditions.
But does public health need to intervene in these situations where migrant workers are put at greater risk because of their close proximity and not ideal living conditions? That's my follow-up, though, if you don't mind responding to that as well. Dr. New, I know you've spoken French at length about schools and masks and that, and perhaps both of you want to just go over again. What exactly is Health Canada's guideline regarding the use of masks in schools, how children should interact, different ages? Because it seems that each province is making different rules and regulations, yet, kids are pretty much the same and they transmit the same or don't, regardless of whether they're in Ontario or Alberta or Prince Edward Island.
So, Dr. Neil, maybe I'll go first in terms of answering in English. So, reopening of schools is one of the most really busy areas of planning right now because of where we're at in the school year. And public health, as well as school boards, parents, are engaged at the local levels in looking at what is the safest way of returning to school, because schools are important to children. So I think, our recommendation, and this is in collaboration with province territory, would say that non-medical mask plays a role in reducing transmission of COVID-19 in the school environment. So wearing these masks is an additional personal layer of protection, and that they should be recommended as such to help prevent transmission in that setting. We are still learning about the role of children in transmission. But as Dr. New has said, more and more is now known that, in fact, older children over the age of 10 transmits as well as an adult. Younger kids, even if they transmit at a lower likelihood, they still can transmit. So I do believe that, in recommending the safest way to open schools, masks they play a role. They're not the singular role. You have to have layers of protection, but it's added on top of the hierarchy of controls. What we call that is arrange your school environment physically and otherwise so that physical distancing can happen. Ensure that the number of contacts children and teachers have is minimized so that you can put kids in the small groups that only interact with each other. There seems some really innovative educational approaches that I believe you will see coming out, where older kids can, instead of doing, physics 1 hour, chemistry another hour, something else, is that they will be grouped so that you can have 2 weeks of learning in this same group for a topic and then switch to another one, so that you're not bouncing around all day and have different teachers that have to sort of mix with you. So minimizing mixing and the number of contacts is one very important approach, as well as all the hygienic hand hygiene measures. We're also looking more now at the role of ventilation. So open the windows if you can, go outside if you can, but what can be easily adjusted in terms of looking at that as well. Physical barriers that might be helpful. All the signs, indications that you see in offices now will be in schools at helping kids maintain those distances and practices. So it is a very multi-layered approach, but should be in line with what's recommended in the general setting as well. So, it's an indoor enclosed environment. So I think masks play a role, and it should be aligned with the child's developmental capabilities. But I think that it's an important additional layer of protection.
So, but just on masks, though, specifically, there was a lot when the pandemic first started, there was a lot of back and forth about the efficacy, ultimately resulting in now we wear them when we're inside in closed spaces, can't social distance. So children in a classroom, regardless of their age, should they wear a mask from kindergarten up to age 10 and beyond? There seems to be still a bit of confusion on that.
So I think the recommendation is that if you're older kids, it's an added layer of protection. I think schools should recommend it. Younger kids develop, mentally speaking, it needs to be adjusted to their ability to wear it. But as Dr. New says, so I think that in elementary schools, and taking into account that, maybe this age group transmit less, we still don't know, actually. Let's make sure that we keep collecting the data. Then maybe more adapted to the children's ability, and but also if someone wants to wear a mask and they're young, let them. Don't stigmatizing them. Don't single them out in any specific way. It is an added layer of protection that any child should be able to wear as well. Of course, the protection of teachers are very important, and they are older people, of course, adults, more susceptible to a perhaps severe illness. So we have to protect the staff, whether it's physical barriers, masks, etc. And maybe people with underlying medical conditions need actual evaluated at an individual level as well.
Martin from Radio-Canada. Sorry, it's my first day. So just to clarify, because we didn't get quite the same answer in French and English regarding masks in school, are you recommending that in schools, students over the age of 10 wear masks across the country? Si on peut avoir la réponse en français aussi.
Could we also get that answer repeated in French?
C'est parce que, en fin de compte, on sait.
It is difficult because at the end of the day, we know that education and healthcare and public healthcare falls under provincial and territorial jurisdiction. We are at the federal level, and we always do discuss with our counterparts in the provinces and territories, but we recognize that this decision is theirs to make. Let's take the example of Quebec. Facial covering is mandatory in all indoor settings. And I think that that starts at the age of 12. Yes, that's correct. And I also think, therefore, that when we're talking about schools reopening, this is the same principle. As Dr. Tam and myself have already highlighted, wearing a mask is another layer of protection. It is very effective, it doesn't cost very much money, and it is easy to implement. And so, to answer your question, yes, I think that. But then we have to ask, should it be done for all children? Is it really an effective protection for children above the age of 10? And I'm not an expert, but I do understand the notion that for very young children, facial expressions is a very important aspect. The teacher's facial expressions are very important for the young child. And so, if the teacher's face is covered, that could be an impediment to children's learning. All of these factors should be taken into consideration. And at the end of the day, we don't only have masks, as Dr. Tam highlighted. What other options are there? For example, social distancing, physical barriers, and highly accessible hand-washing stations. But yes, certainly wearing a non-medical mask or facial covering is important. I think it is an important aspect of a well-rounded approach.
Maybe juste pour simplifier.
Just to simplify the answer, we will be publishing the guidelines this week, very shortly. They will include recommendations regarding masks. The general recommendation is that the mask should be worn by children over the age of 10 years. For children under the age of 10 years, more considerations should be taken into account.
But that's the sort of bottom line. But can I just say that as all Canadians have seen, that the recommendations for masks will undergo evolution as the evidence changes. And we will also have to see what happens as we understand transmission in different age groups and what happens in schools. And please expect, we must well just forewarn people that we may have to adapt this recommendation as we go along. Thank you.
Okay. Thank you, Dr. Reporter. Just a quick reminder that in the future it is one question and one follow-up. So that concludes today's press conference. Thank you.
Thank you. Merci.